Before starting to use this slideshow, please read the disclaimer carefully. The purpose of this slideshow is to demonstrate how to use the OVT program. For more details, please refer to the Word document that is attached to the OVT package called OriLens Vision Testing, or OVT, Optical Testing for OriLens Implantation. For any more information, please contact info@optolite.net. Optolite developed a special computer program for testing potential candidates, the OVT, or Optolite Testing Program. Optolite recommends that before making the decision on surgery, each OVT result will be verified by a traditional optometric testing. You will need an external telescope with 2.5 times magnification. The OVT program is used for patient selection purposes. The OVT was not yet fully validated. We're currently working on it. So before making decisions on surgery, please use the conventional vision testing technique as well. A comprehensive manual is supplied along with the software. The software can be installed on any PC. Data handling and storage are performed automatically. The program can be used before implantation, for patient selection purposes, for testing with low contrast, for testing after implantation, follow-up. What do you need to perform the OVT testing? 1. The program itself, which is supplied free of charge by Optolite. 2. A computer and a screen that has been configured for the program. See Screen Configuration on the cover page of the program. 3. An external telescope and accessories for vision testing. Testing is always done while the patient wears the BCVA eyeglasses, and each eye is tested separately while the fellow eye is covered. Adjust the patient's distance from the screen to the test that you are performing. Now let's begin with the actual program. This is the front page that opens once the program is started. The first step is to perform the screen configuration. This should be done in order to fit the size of the letters to your screen size so that the size of the letters on the chart is standardized. This process should be performed only once in order to fit a given screen size. Click on the screen configuration. A small window will open. Click Edit and fill in the size of your screen. The table below with common standardized sizes of the screen may help. And then click OK. If you are testing a new patient, click on the New Patient box. A small window will open and you can fill in the patient's data. It is not mandatory to fill in all of the spaces. However, you need to fill in the patient's ID and the patient's first and last names. Now let's start performing the testing. Click on the pre-op testing and a small window will open on the upper left-hand side. Click on the test that you want to perform, right or left eye, and distance or near. Click Start. The EDTRS chart will show up. On the upper larger letter lines, you will not be able to see the whole line. You can play with the red cursor to locate the missing letters if you need them. Indicate the testing distance that you would like to test on the right-hand lower side. Usually, low vision testing starts at 2 meters, and if needed, you can go to 1 meter or 4 meters according to the patient's visual capability. Then, let the patient read the lines while wearing his or her best spectacles and click on the last, that is smallest, red line on the left-hand side. So if the patient was able to read until the fourth line, click on number 4 on the left-hand side. The last line that the patient was able to read will appear alone on the screen. Verify that the patient can read it. You can always scroll to a larger or smaller line by clicking on the blue cursor's up or down signs on the lower left-hand side of the screen. After verification, click Continue. On the screen, the last red line will appear at the bottom, and a double-sized line, 3 lines higher on the ETDRS chart, will show up. Explain to the patient that this is the smallest size which he or she will be able to read following surgery. In this example, you will see line 4 in the size of line 1 after the telescope is implanted in your eye. Now you will see on the screen the last line that the patient was able to detect on the upper side, and on the bottom you will see a line that is 2 times smaller. Verify that the patient can read the upper line. If needed, you can always click on up and down on the blue button at the lower left-hand side. And obviously he or she will not be able to read the lower, smaller line. So give the patients a 2.5 times magnifying external telescope and ask them to hold it in front of the tested eye to verify that they can read the lower line with the telescope. If yes, click on Save. A central small window will show up and present the data that were collected on the tested eye. Check and click Yes. This confirms that the tested data that were collected on the tested eye until now have been stored. Now click on Adjusted Contrast on the right-hand side. Up until now, we've tested that eye in full contrast. By moving to Adjusted Contrast, the patient will be presented with the actual contrast that the eye will see on the Adjust chart. This decrease in contrast occurs due to the magnification, since the same amount of light is projected on a larger area as seen by the patient. On this slide, you will see the same screen as before, but with lower contrast. Verify that the eye can see the upper line with glasses and the lower line with glasses using the 2.5 times magnifying telescope. You can always use the up or down buttons on the lower left-hand side of the screen if needed. Click Continue. Again, the same windows as were shown in full contrast will pop up. Click Yes to confirm the data and then Save. Now you've returned to the front page and you are ready to continue to test the fellow eye or test near vision on the same eye. To do that, please indicate what you would like to test and click Start. In this demonstration, we will proceed with near vision testing in the same eye. Now we see the near vision ETDRS chart, and basically we follow the same procedure for near as we previously did for distance. First, locate the distance of testing. Usually we start with 40 centimeters, but if the 2 upper larger lines cannot be seen, then start from 20 centimeters. Click on the last line that was detected on the left-hand side. The last line that was detected is shown alone. Confirm that the eye can see it and click Continue. The last line that was detected and the line that is 2 times smaller will appear. Confirm seeing the last line that was detected by the patient with reading glasses and the smallest line with the external telescope after being adjusted for near. Click Save. Confirm and save the data. Go to Lower Adjusted Contrast. Confirm that the patient sees the relevant lines, the upper line with glasses and the lower line by adding the telescope. Then click Save. Confirm the data that are saved. You are now returning to the front page. When clicking on the Post-op button, you will open the small upper window, which will enable you to select the eye to be tested. Click Start. The ETDRS table will be presented. Have the patients read until the last smallest line they can see, and click on the line number on the left-hand side. Confirm reading the last line. Click Save and confirm the information, and then click Exit. This slide presents the option of seeing the data that were saved. Click on Show Data after selecting the right file according to the patient's name and the test that you performed and would like to see. The data that were collected before are presented. If you would like to see the entire list of the tests that you have performed, you can always enter Directory, where the software package was saved, and click on patientsdata.xls for the Excel files with the database. You will then see the list of tests that have been performed, and the patient's data will also be presented. We hope that you've enjoyed the slideshow. For any clarifications, please consult the Word document that we've attached together with the package that you've received.